Real life.
Hello, everyone. Welcome to this Community Connect session of Rhetoric of Rights to Reality of Rights, a human rights based response to TB. I'm Daisy Lekaru, disease advisor from the Global Fund, and I have with me co chair Blessina Kumar, who is the CEO of Global Coalition of TB Advocates. We have lined up speakers for this session, and let me introduce the speakers to you. We have Timothy Wafula from Kenya, who will be speaking on where we have been, a historical perspective on a human rights-based TB response. We will have Meera Yadav, who's a TB survivor from Global Coalition of TB Activists, who will be talking to us on the barriers to accessing care on yesterday and today. We have Jennifer Ho from APCASO, who will be talking to us on the role of regional platforms and coalitions in furthering a rights-based response to TB. We have James Malar from Stop TB Partnership, who will be running us through the Stop TB experiences and tools available for communities. After the presentations from our speakers, we will be having question and answers and it's discussion on the forum. We look forward to an interesting panel discussion. And I request Timothy Wafula to go ahead with the first presentation on where we have been, a historical perspective on a human rights-based TB response. Over to you, Timothy.
Thank you, Daisy, and hello, everyone. So just if I may just share my screen, just 1 minute. Okay, thank you all for joining us for this, and I think we also want to thank the Community Connect for giving us this platform. So I will quickly just have a conversation or just talk briefly around where we have been and just a quick historical perspective on a human rights-based approach to TB. So first of all, it's now clear from the global strategies that we do have that a rights-based approach in responding to TB is indeed key. So from all the global plan to NTB, the UNHLM political declaration and all that, now all the strategies are really speaking to having a rights-based approach. So this approach is also very well now clearly articulated in most of these strategies, and that this stems from the need and the recognition that there's actually need to transform the TB response to be equitable, to be rights-based, and to be people-centered with a proactive efforts to ensure that all key populations are reached. And something that is important to note is that there's now a growing recognition that actually promotion and enforcement of human rights is essential to overcome many of the barriers that stand in the way of TB, patient access to critical services. And this recognition, I think, has really stemmed from the growing body of evidence, both at the national and the global level, stemming from even the kind of tools that have been utilized, the CRG assessments from the countries, just to be able to understand what these kind of barriers are. So with this evidence that is there, it's also now clear that actually the legal environment is really, really key in addressing TB. So that is where we are currently. So a quick thing to note that, and which is also a growing recognition, is that throughout the long history that we've been having TB, there's been that disproportionate way in which TB has been affecting the society, and I think we will be able to appreciate the fact that poverty, social exclusion, and these kind of factors have really exacerbated and exacerbated TB in the community, and we've had other conditions that have really created a population that is also at a heightened risk of getting TB, conditions of poverty, social inequality, marginalization, substandard housing, poor sanitation, and all these social factors that do exist. So despite this recognition, I would also just want to mention that the response has not always been geared towards addressing rights. So I think historically in the past, the focus was more on the biomedical aspects, and it's only recent that we've seen a more concerted effort also to address the issue of rights. So policy frameworks previously really talked to addressing the biomedical issues and were oblivious of the human rights barriers that hinder access to services such as these economic, social, geographical, and health system barriers. And it's in this environment that I think we've seen discriminatory policies coming in place, increase in stigma and discrimination, policies that actually violate or breach the right to privacy, policies that policies that speak towards compulsory detention, isolation, and other forms of punishment or criminalization of the TB response, as well as systematic exclusion from TB prevention, diagnosis, and care. For instance, for prisoners, migrants, refugees, nomads, and displaced people. So this has been where we have been, that the policies really did contribute to this exclusion, this creating of the TB key and vulnerable populations. So, and something that I think, just picking this quote from Justice Ndigale, who notably said during the Nairobi TB workshop that people with TB experience infringement of the human rights on a daily basis. In far too many cases, they lack access to effective testing and treatment, face discrimination in employment and healthcare settings, and are necessarily detained and isolated against their will. This is where we have been. And I think maybe as I conclude, just a word of caution that uh, uh, this, we are not yet out of the woods. We are not yet out of this situation. We still have this kind of environment existing, and that one calls for increased implementation of the existing strategies to ensure that the rights-based approach, speaking to rights, addressing discriminatory policies and laws, is actually taking place, and there's increased investment in that, so that we can get where we want to be, so that we do not stay where we have been, but actually move a step further. And yeah, with that, I think I will thank you.
Thank you very much, Timothy, for that. I just also wanted to welcome everyone on behalf of the Global Coalition of TB Advocates. We were very excited to organize this session because I think we have started with human rights and TB fairly recently. It's still a new area, but we are encouraged to see the momentum. So we thought we should have people who have been involved in it actually share some of the experiences. And as Timothy said, we don't want to see where we have been. I think it's important to see where we are and where we can go in terms of human rights. So just welcome everyone. And I think we have a very exciting panel before us. And I would actually call the next speaker Jennifer to share, because we are still waiting for Meera, who's having some technical issues. So, Jennifer, the floor is yours. Thank you. And she will be sharing with us the regional CRG platform and how that is actually contributing to progression of the human rights response in TB in the region. Thank you, Jen.
Great. Thank you so much, Blessy. And I think I'm going to take this opportunity to speak a bit more than just the regional platform, but really more around the general roles of regional platforms and coalition. So thanks again for the opportunity to share our experience from Asia Pacific on the roles of regional platforms and coalition in furthering rights-based response to TB. Yes. So I'm here today representing these three networks and platforms, ACASO, APCRG, and ACT-AP. SubCASO is an Asia-Pacific regional network of civil society and community-based organizations working on health, social justice, human rights for key, vulnerable, and marginalized populations and communities in Asia-Pacific. We also serve as a catalytic platform for advocacy and community systems strengthening, including movement building. Relevant to today's session are our roles as the host of the Asia Pacific Communication and Coordination Platform on Communities, Rights, and Gender, also known as APCRG, supported by the Global Fund, and our role as the co-founder, the Secretariat, and an implementing partner of the Activist Coalition on TB Asia Pacific, also known as ACT-AP. My slide is not moving. Give me a second. Okay, so before I speak directly to our topic today, I want to share a thought-provoking question I received from an audience after my presentation on political accountability and the roles of civil society at last week's Global Symposium on Health System Research. So at the end of my presentation, someone from the audience asked, how do we deal with the fragmentation within the civil society movement, with competition for funding being one of the key driving factors of this fragmentation, and what would motivate people and organizations to want to work together? And I thought this was a rather poignant question, and it reminded me of our work in mobilizing civil society for joint TB response exactly 6 years ago to the day, as you can see in the first photo on the top left. And I won't say that it has been an easy journey for CASO and our partners coming together. However, what I can say is what kept all of us moving through phases of trust building, pains of repeated funding request rejections, was our shared belief for the need, in the need for people-centered and rights-based approach to TB responses in our region. That if we are ever going to be any closer to end TB in one of the heaviest TB burden regions in the world, we need to challenge the biomedically driven approach to TB response that we saw in our region, and that we needed to challenge the ways in which such approach continue to perpetuate inequity and injustice to vulnerable populations and communities in our region as well. And so I think it was through this reflection that I believe that one of the most important roles that regional networks and platforms can and must play in advancing rights-based response to TB, it's in coalition and partnership building. Simply put, to bring people and groups together on their shared goal. And this coalition building has to be done at a global, regional, country, and grassroots level. And we must prioritize building of TB-affected communities and TB survivor groups to ensure their leadership roles in our movement for rights-based TB response. And so the photos you see are various coalitions and partnerships that we have formed and developed over the years at regional and global at grassroots level. And just in an interesting time, I won't go into too much detail of it, but happy to discuss more about it later in terms of who we have partnership at the various level later. The next slide. Sorry, my slide's just really not moving here. Here we go. Another important role that APCASO, APCRG, and ACT-AP have played in furthering our agenda on human rights, it's in facilitating and creating space for dialogues and experience sharing for communities of people affected by TB, TB survivors, and civil society advocates. And we've done this through information sharing, consultations, webinars, and virtual and in-person meetings. Resource development, such as our leading role in the development of human rights training manual for people with and affected by TB, and the community scorecards for TB care and services. My slides, it's going crazy. Have further increased awareness and engagements of communities and civil society on TB at a country level. And this has also contributed to evidence building by communities and people affected by TB directly and give visibilities to their issues. APCASO and ACT-AP, we continue to invest in community capacity building as well. And this includes strengthening communities and civil societies groups, understanding on rights affirming approach to TB through tailored workshops, long-term capacity building, and mentorship support for effective TB community engagement in-country global fund processes, including their capacity to influence within-country coordinating mechanisms. And we have also supported the development of workshops and skills trainings on leadership and advocacies. Lastly, regional networks and platforms can play a leadership role in facilitating and coordinating advocacy efforts, in particular, building strategic links between the global, regional, and country level advocacy for TB. And an example of this support is our ongoing effort in the rollout of the community scorecards for TB services at the country level. The data collection processes are being led by local community organizations. The results of the scorecards are then presented at community consultation meetings for validations, follow which it's development of country-level advocacy plans and activities, such as advocacy campaigns to reduce stigmas in healthcare settings, and advocacy strategies and plans to influence the national TB programs. And our upcoming advocacy coordination effort at the regional level will focus on connecting the issues identified at the country level through these scorecards and the country level advocacy activities with the regional and global civil society mobilization for the upcoming high level meeting on TB next year. And just to acknowledge the support of the Stop TB Partnership and also the Global Fund in making the necessary resource available for us to carry on this work, especially around advocacy and community mobilization. And lastly, I want to conclude my presentation by sharing with you the Asia Pacific TB and human rights advocacy strategy. And this strategy was developed in consultation with all of our partners, and it forms the basis of our advocacy work at the global, regional, and country level. And each of the objectives have been aligned with a UN high-level commitment on TB. I won't go into the details right now. However, you can find a full document on our website under the program subheading, The Right to Breathe. And I would encourage all of you to please have a look and hopefully be inspired by the coming together and the advocacy of TB-affected community and civil society from Asia Pacific. And so with that, I conclude my presentation and thank you once again for the opportunity to be part of this discussion.
Thank you, Jennifer, for your presentation and for sharing useful insights and also demonstrating and telling us about the role that APCASO has played in facilitating and also the tools that are available and that you've been helping countries in different roles. And there are tools which are available which countries can access and partners can access. So now we move to the next presenter. We have James Mallar from Stop TB Partnership, and he will be sharing with us tools that are available for communities. Welcome, James, and giving the floor to you.
Thank you so much, Daisy, and a big thank you to Blessy and the GCTA team for organising this important discussion, but also to just quickly acknowledge the previous speakers, Jan and Timothy, like lots of amazing work. And I think, hearing a lot of the great initiatives that community have really led really emphasises the importance of this particular area of work. So I just have a couple of minutes and I'm going to talk a little bit about TB CRG tools, evidence, and provide a little bit of a global perspective on this. So just have to make these slides work. Okay, so first and foremost, Jen just mentioned in her last remarks around the fact that there's a United Nations high-level meeting on TB in 2023, just next year. This will be the second one, and it's going to be a critical moment to build in commitments around TB and human rights. You can see on the slide that in the original or the first TB high-level meeting, there was a number of commitments that already exist in relation to TB and human rights. These can include things like ending TB stigma and discrimination, access to medicines, removing legal and policy barriers, gender equity, psychosocial support, and I guess the overarching theme of an equitable and rights-based TB response. So what we can see is that these have already been acknowledged as being critical. But what we also must need to acknowledge is, as Timothy mentioned in his opening remarks, there's clearly a need to shift away from a biomedical TB response. But the reason why we need to do that is because all of these issues are barriers for people accessing TB services. If we're unable to identify, mitigate, and overcome these, we won't be able to find the missing millions. These people will still experience barriers in accessing the services they need. And that's why this is a critical area that demands more attention in national TB responses. So there is a number of tools that have been developed to help support communities and national TB programs to really take forward this work. You can see that first among them, there's a TB community rights and gender assessment and a costed CRG action planning protocol. Second, there's a TB stigma measurement assessment. And I note that this measurement assessment is significant as its key indicators have been incorporated by the Global Fund into its performance framework. Therefore, country partners can all do this work and incorporate it under your Global Fund grants. Thirdly, One Impact community-led monitoring application framework and approach. We now have an established approach for TB community-led monitoring. And this is something which has now been picked up in many countries, but it's going to be critical to take this to scale to ensure that we can monitor and respond to human rights issues in real time. Thirdly, there's a number of pieces of operational guide human rights that have been developed by TB communities themselves. I note GCTA has developed the Activating Rights-Based TB Response. I note APCASO and ACTA Asia Pacific have developed a Right to Breathe. And I note the Declaration of the Rights of People Affected by TB people are all critical pieces that have helped inform this work, all of which build upon the Nairobi strategy of TB and human rights, which Kaylin played a leading role in developing initially. Quickly, I note as well that there is two more pieces or two more tools that are about to emerge. Firstly, a TB key and vulnerable population size estimation tool. This is going to be critical so that we can understand more about those groups of people who are particularly vulnerable and need nuanced programs to access TB services. And secondly, a TB legal and human rights and enabling environment scorecard so that we can enhance accountability in this area of TB and human rights. Challenge Facility for Civil Society is one of the key mechanisms to fund this work, and it is something that with the support of USAID and Global Fund, we've seen continue to increase. But it's also something that we know needs to have enhanced attention, and we hope to have more and more supporters come on board to ensure that investment in this work can continue to scale up. One of the things that's particularly important here with all of these tools, though, that has been described is the fact that there needs to be partnership with national TB programs to sensitize, to build capacity, to build ownership. TB-affected communities has a strategic advantage to lead this work, but to make it effective, there needs to be those partnerships with national TB programs to really take it forward and make it work. Interestingly, the new Global Plan to End TB 2023 to 2030 has translated some of the targets from the UN high-level meeting some of the commitments from the UN high-level meeting and turn them into targets that we can hold countries to account. This has included requesting to realise an equitable and human rights-based TB response, that all countries complete TB CRG assessments. Countries then develop costed TB CRG action plans. They integrate those in their NSP and subsequently fully fund those plans. We've seen excellent examples in countries like Bangladesh, Nigeria, Tanzania, DRC, and Philippines that have completed TB CRG action plans, and the challenges for other countries to also follow suit. Of the TB CRG assessments as well, we've seen a number of key themes that emerge. It's now the evidence base upon which we can argue for a rights-based TB response. These are the issues that need to be focused on and addressed. It includes issues around these 7 key themes, including affordability, accessibility, availability, and quality of TB services, stigma and discrimination, key and vulnerable populations, freedoms like privacy, confidentiality, and movement, the participation of key and vulnerable populations, gender, but also the need for legal and also administrative remedies when human rights related barriers need to be addressed. I note that you can find a link in the slide to a peer-reviewed article which documents this important evidence, which would be adduced to national TB programs, TB partners, and responses all around the world. As I mentioned, this is the TB stigma measurement assessment with 3 key indicators around self-stigma, stigma in family, and stigma in healthcare settings. This could be a critical tool for all national TB responses and can be included in your Global Fund funding requests. Finally, this is a bit of a snapshot and an introduction to community TB-led monitoring. You can see that there's over 20 countries that are in the process of adapting and piloting the tool. But what's going to be critical and next step is taking community-led monitoring to scale. We need to have access to community monitoring tools to really document human rights-related barriers and to trigger responses from communities to those human rights issues in all countries and among all TB programs. So 5 quick takeaway messages as I conclude. Firstly, we now have more evidence than ever on TB-CRG and the need to overcome human rights barriers. Second, to achieve UN high-level meeting targets and commitments, there's a need to undertake a TB-CRG assessment, develop a costed TB-CRG plan, and integrate this and fully fund this plan. Third, community-led monitoring is a critical tool and it must feature in all national responses. Fourth, indicators to measure stigma are part of the Global Fund performance framework, and communities and national programs should take advantage of this to increase funding for this area of work. And finally, we need to enhance funding for TB-affected communities and civil society to lead this work. And that's a call to action for all donors and all technical partners. Thank you so much for the opportunity to contribute.
Thank you very much, James, for that. And there's been significant amount of tools available. And thank you to Stop TB Partnership for developing these and making it available for the communities. And I think we really need to support communities, as you said, to roll these out and to make use of it. So thank you for sharing that. I'm sure a lot of people will be coming back to you with many questions. Our speaker, Meera Yadav, is unable to join because of some technical issues. It's rather late in India, and she's also having internet issues. But she has sent a few points that she would like us to share. And if we could make GCTA team member Priyanka Iyer speaker, she would share Meera's notes very quickly in a few minutes. And just to introduce Meera, Meera is an XTR survivor, XTR TB survivor, and she had TB in 2013 and really went through a hell of a time with very painful injections and not responding to many things, really not having a lot of choice. One of her lungs had to be removed. So she now survives with just one lung. She's a member of the GCTA, great supporter of GCTA, and we work very closely with her. She lives in Mumbai and works and supports people on the ground, TB survivors, people with TB get access to treatments. She also helps us in our advocacy with the National TB program and is a speaker sharing her story on many of our sessions. So, Priyanka, if you could kindly just share her notes with everyone. Thank you.
Thank you, Blessy. And I would like to thank Meera for giving me the option of sharing her story. She's not able to join us because of some technical difficulties. So I will read out her message for everyone present here. Hello, everyone. I'm extremely sorry that there are a lot of technical issues and I am not able to access this platform due to some network issues. But for my address, I'd like to say, first of all, I would like to say thank you to GCTA for giving me this opportunity to share my experiences on this platform as a part of the union conference. And when we talk about the barriers that a patient has faced and continues to face, we can just take a look at the WHO TB progress report, and the data is clear and right there in front of us. There has been a lack of gene expert machines. There is a lack of TB awareness. There have newer drugs are not available, and local vehicles and transportation services still continue to be a huge barrier for people trying to access TB care and treatment. I feel sometimes that there is no one who is taking seriously the TB disease, and there is a huge gap in TB testing. Our laboratories continue to be understaffed, And if I would like to say anything at the end, I would say what the challenges that a patient faces today for accessing treatment and care are five. Here are my five top points for that. There is delayed treatment and diagnosis, and then there is inadequate monitoring. Then we do not have unified TB regimens, and different TB regimens are being followed in different parts of the world. Then we have issues of non-adherence, where TB patients do not get the support that they need to complete their course and get their lives back on track. And then difficulties in managing adverse drug reactions, because they do not have the counseling support and psychosocial support to understand how the adverse drug reactions are affecting them. So this is the address from Meera Yadav, a survivor from India. Thank you, everyone.
Thank you very much, Priyanka, for sharing the words from Meera, and thanks to Meera, though she's not here. But we've heard her story. It's been a difficult journey for her, but we're glad that she's fighting for TB for the community and addressing people's and trying to find solutions for others who are in the same battle in the fight against TB. So we have the Q&A session right now. I'll take a few questions that are there, but if there are additional questions, please do let us know. The first one is to all the speakers on what are our key asks for UNHLM when it comes to human rights and gender. I give the first question to James. There's another one for James as well, and James can address that, and we can go to the other speakers. For James, how many countries have conducted legal environment assessments and CRG assessments on TB across the world? So, James, the floor to you, please.
Thanks so much, Daisy, and for the question from those involved in the discussions. So we're currently at a stage now where there was an initial series of 20 countries that completed a TB-CRG assessment, and that data was analysed and subsequently published in the article that I shared in the chat. An additional 8 countries are now completed or are almost completed. So we're at that point now where there's close to 30 countries who have completed the TB-CRG assessment. But what's particularly important is that TB-CRG action plans are developed. That is, costing interventions and then making sure funding is received to implement those interventions to address the issues that were raised. And there's about 6 countries that have done that, and that's where a lot of work and attention is going to need to be focused. Thanks, Daisy.
Thank you, James. Jen, would you like to address the question on what are our key asks for UNHLM when it comes to human rights and gender? You work very closely with communities across as a platform. It would be great to hear your perspectives as well. Okay, I don't see James. I don't see Jen. Maybe we can go to Tim, and there's a question for Tim as well. So what is the funding cascade for human rights interventions in Africa? So Timothy, please.
Okay. Sorry. Okay, thank you for that. So maybe just to mention is that when it comes to human rights interventions with regards to TB, the funding landscape is not what it needs, what it should be currently. So we can say that for very, we see that the demand, the need to ensure that there's understanding of rights, both at the community, both at the policy level, both with the government and all that. There's that strong need to ensure that this understanding is across all levels, and also just ensuring that the support for access to justice programs and all that. But the funding has not really matched the need or the demand for that. And I think one thing that I can quickly appreciate is the support that comes from Stop TB, the civil society challenge facility. I think that's been one of the main one of the grants that has really ensured that there's continued conversation, there's continued engagement, and there's continued there's continued funding for when it comes to human rights interventions. But I think, and this is an important aspect, that as when we speak to our governments or donors, that there's actually need to invest more when it comes to human rights in the region. Yeah, thank you.
Thank you, Timothy. There's another question for James on from the audience. Do we have a position where we can harmonize the human rights agenda from UNDP and Stop TB in our implementation? And James, there have been, you've mentioned about different tools, about UNHLM, the CRG assessments, and other tools, CLM, community-led monitoring tools, etc. If you can highlight a little bit also on, Timothy also mentioned about the challenge facility for civil society and how that has helped in addressing some of the barriers, it'll be great as an intervention. Over to you, James.
Thanks so much, Daisy, and thank you for the question as well from the group. Look, so a couple of things there. I guess that there's been a lot of partners who have really played important roles in advancing human rights or this equitable and human rights-based TB response. I think obviously from the side of Stop TB, you've played like an important role as, I guess, a technical lead in this. As I mentioned in my presentation, a lot of the TB affected communities and civil society have also led in a lot of the things that they've produced. Global Fund has a CRG team, integrates that in all of the grants. WHO also has guidance around ethics and human rights. And so UNDP also has a really, really important role to play here. And I know that UNDP have supported a number of really important initiatives, including like legal environment assessments, for example, in Ukraine. One of the things to note is the TB-CRG assessment. It takes on board the legal environment assessment, but also the gender assessment and a key populations prioritization assessment. So this is a way where you can deal with a broader spectrum of CRG issues and develop a practical way forward. And I think that that's certainly something which all the partners are working to sort of do, to really address this issue, to identify barriers, to overcome those human rights related barriers. And to do this in a way that's streamlined and effective for national TB programs and national civil society and affected community partners. So that's the first thing. So I think that there's always opportunity to continue to work together, but I do think that there is quite a bit of alignment already in terms of what a human rights-based TB response looks like. The second thing, Daisy, to pick up on your point around challenge facility for civil society, this is a really unique mechanism. It actually is funding communities and civil society, predominantly at the country level, to lead this work, to develop tools, to pilot them, to undertake advocacy, demand generation, accountability, and also to implement the tools like the CRG assessment or community-led monitoring. Maybe just 5 years ago, this mechanism only had maybe 17 grantees or 10 grantees. And now, with the new round 11, with support of USAID and the Global Fund, we now have 100 grantees covering 29 countries. So this is a remarkable area of scale up to support TB and human rights-based work. And it's something that I think that we can all really acknowledge, that it's a remarkable achievement, and the donors have played a really key role, but it's been the excellent work by communities on the ground, which has really shined a light on this area of work and the reason that it is getting increased support. So hopefully, through this mechanism, but also through other mechanisms as well, hopefully we can see a continued increase in funding for TB-affected community and civil society initiatives to identify, monitor, and overcome human rights barriers and contribute to ending TB. Thanks, Daisy.
James, I hope that helps clarify some of the questions. There's another one from you for you again. I just also wanted to mention that from the Global Fund, we have been supporting some of these tools to address some of the barriers related to human rights, whether in the form of CRG assessments or legal environment assessments, the human rights scorecard, stigma assessment, costed CRG plans. But we need to do more, and we totally agree, and we would love to support the work of the communities. We are getting more and more evidences from the work that's been done and how we can shape the CRG interventions better. I take another question. There are a couple of them here again. How best can we harness lessons learned from HIV and COVID for TB human rights in light of reduced TB resources? So, James, Timothy, would you like to take the question? And there's another one also from Dr. R.K. Sood, India. Do we have a tool for stigma assessment for India? how can we use this? We would like to use this. So, questions for James and Timothy. Can you actually address that?
Timothy, if Timothy wants to go first, I'm happy to wait. Over to you, Timothy.
Okay, thanks. So I think maybe I'll start with just the question around the lessons from COVID. And I think one key lesson that I can say we are picking from COVID is with the pandemic, I think we did see the kind of response mechanism to address COVID that was there that has really been a key lesson. And I will say that if the same a key lesson that just demonstrates that if there is that concerted will, there's all the players come together, then and having the same kind of level of response to TB, then we'll make a lot of progress. I think with COVID, we did see a lot of kind of response coming in, rapid development of vaccines, diagnostic tools, and all that. And I think that is really a key lesson that I think going forward, as even we address the existing diseases that we have and TB, then that needs to come out. But also, we also need to see that with COVID, there's also another lesson that came in when it comes to issues about human rights. I think we were able to witness that the gains and that when it comes to rights, there's it's easy for them to be eroded. That we were not yet there. We still witnessed a lot of rights violations, the response not being rights based and all that, just also indicating the need that for this kind of conversation to continue, because we saw how quickly we were able to relegate rights and address COVID in a way that really violated right to privacy. It created a lot of stigma, discrimination, access to vaccines was a disaster and all that. So then that clearly indicates that the work that we're actually doing, the speaking about rights, is not done, and it's something that we really need to keep on talking and advocating for and ensuring that the conversation continues. Yeah, over to you, James.
Thank you very much, Timothy. And just wanted to also add that we need to enhance domestic financing for CRG related issues and not just be dependent on donor financing. The last question for James, and I give the floor to my co-chair, Blessy, and then we can close the session. So, James, can you address how can countries access the stigma assessment tool, and would you be supporting in the access of this tool? And the question is from India, but I think it'll be useful for the others to know as well. James, over to you.
Look, thanks so much, Daisy. I tried to share the stigma assessment tool in the chat, so hopefully that's something that's available for all participants. In addition, you feel free to reach out directly to Stop TB, and we'll be able to facilitate that. It is publicly available on the webpage, and we can also provide guidance and support to help implement it. So I think that's the first thing. And then secondly, to pick up on the TB, COVID, HIV question, look, I think one of the things that we learned, there was a lot of challenges and risks, like Timothy just highlighted, but I think that there was also some lessons learned and some opportunities. I think that we learned that, if we're going to effectively address disease response, we have to also address stigma. We saw that in COVID, and it was a critical step that was taken. Secondly, we saw some of the most effective interventions in terms of the country level for COVID were community-led. Therefore, we need to have investment in communities to build those systems to can respond to TB, to HIV, to COVID, to future pandemics as well. Same deal we saw for new tools. We saw vaccines appear so rapidly. This is a human rights issue. For TB, we've been waiting for so long, and we need to see an operational, safe, equitable, and accessible vaccine as soon as possible. I've heard community statements call for this by 2025. And then two final points. One is CLM, community-led monitoring. This is something that's applicable for TB, but also for COVID and for future pandemics. Let's build systems that can help people who are recipients of services report on quality and help to strengthen them. And finally, key and vulnerable populations. We need to make sure that the interventions that we're doing, that the initiatives we're supporting, really put a focus on those who are most vulnerable and are nuanced and can reach them accordingly. Thanks, Daisy. Thanks, Blessy.
Thank you very much, James, and thank you to all the speakers. I would like to give the floor to my co-chair, Blessy, for the closing remarks, and thank you for an interesting discussion, presentation, and also thank you for your questions. Blessy, over to you. Final words, please. You're on mute.
You hear me?
So if muted again, you need to unmute
Yeah.
yourself.
Can you hear me
Yeah.
now? It keeps going to
Yes.
mute.
Perfect.
Yeah, thank you very much for this wonderful session. Just in closing, I want to say that as GCTA works with survivors across the globe, one thing it's very sure that we cannot achieve our targets without concentrating on things like community rights and gender, equitable access, and access for everyone. We can't have a approach that leaves many people out. So I think it's time for us to come together. And also, we need to keep in mind that nobody is left behind, that we as a TB community are inclusive, that we include everyone, because we all have a role to play, significant role that has great value. So I think it's high time that we come together, join hands, and like Jennifer said, we have to work together, irrespective of whatever. If we need to end TB, we have to work together. So we have great opportunities. The next UNHLM poses a great opportunity. Last UNHLM, with all our hard work, we managed to get human rights and stigma and discrimination, addressing these in the top 10 priority of the UNSG report. We are hoping that we can do better this time, but it would take all of us to work together, the technical agencies, the donors, the civil society, and the communities affected, that we need to come together and really work hard to ensure that we reach our targets, keeping in mind that the recent WHO World TB report is very discouraging. It doesn't give us anything to be happy about. So it just means that we need to work that much harder. With that, I'd just like to thank Daisy as the chair and all our speakers. And thank you for your amazing questions, all the attendees. Thank you very much and have a great day and night.
Thank you very much, everyone. Have a great day. Thanks.